Hi, it's Dr. Artis again, and I'm here tonight to share with you some helpful tips again. Do you suffer from swelling in the knees or ankles or the lower extremities in general? If you do, this will be a good video for you to watch. Now, one of the reasons why we have swelling in the knees most commonly is because of degeneration. One of the most common reasons I see in my office. A lot of times with a lot of other people. Some people it's ligament damage, some people it's soft tissue damage from an injury. But if you do, in an acute situation, you want to use the acronym RICE. And I'll explain that more in other things. The same thing with the ankles. If you have swelling in the ankles, typically if you sprain an ankle from a sports injury, you want to follow that same acronym as well. But some people have swelling in the knees and ankles and the lower extremities due to different kinds of heart conditions. Maybe they have high blood pressure, or maybe they have other things like that. That's why it's always good to follow up with a good physical to make sure that your blood pressure is good, blood sugar levels in the right levels, in the right areas. But then following that, if you do get an acute injury, I want you to follow this acronym RICE. And what RICE means is rest. So you need to sit down and rest. And then you got to follow the I for ice. Icing typically takes place anywhere from 15 to 20 minutes. If it's a small extremity like my hand, you don't want to go any longer than about 20 minutes because it's so small that you can actually get all the way down through the hand with ice in about 10 minutes. And you don't want to put ice directly on soft tissue like the skin. You want to put it on like a t-shirt or maybe a towel, but nothing too thick. You don't want to put it through a blanket because a lot of times it won't penetrate through to the skin and get deeper into the soft tissue like we want it to. So we got rest and ice, and the C is compress. That means that you need to wrap it up or put a knee sleeve on or ankle brace or something like that to actually keep that compression down. Another thing I've seen people do is they use compression stockings or compression hose or compression socks. Those are things that actually can keep that circulation moving and actually don't let that fluid sit up on that joint. That is the C. And then the E is elevate. You always want to elevate the lower extremities higher than the heart. That helps to keep that fluid from actually pulling down because gravity goes down. And when gravity goes down, blood pulls down there and it kind of stays. So you want to keep that blood flow circulating, and then that can actually keep the inflammation down and that can promote healing. So that simple acronym is RICE. Now, one of the things that happens when you have fluid that sits on joints for long periods of time, like you see my older people, the seniors, and you got some younger people my age that have swollen joints because they have a lot of degeneration. If that swelling, that inflammation sits there for so long, it can actually eat away at the soft tissue. I've seen some research says that alone. That's why it's not good to have joints that consistently swell like that. It can actually restrict your mobility. And actually, when you look at the lower extremities, like the knees and the ankles, it's going to actually increase the pressure on the nerves. And when that happens, that's where the pain comes from. So one of the easiest ways to do is sit down and remember the acronym is RICE. That's rest, ice, compress, and elevate. I hope that helps you. Again, I'll be back tomorrow with another tip. Please share.